Good morning, and will the Committee of Supply please come to order? This section of the Committee of Supply will now resume consideration of the estimates of families. As previously agreed, questioning for this department will proceed in a global manner. The floor is now open for questions. Ms. Adams.
Thank you. On Wednesday, the minister kept referring to 5,000 childcare spaces that her government had created. But I just want to point out that the way she is counting these spaces is different than the way the previous government counted newly created spaces. To the previous government, the newly created spaces meant funded spaces. However, this government is counting all spaces, including unfunded spaces, spaces that have played zero role in creating. In terms of funded spaces, there were 28,669 fully funded childcare spaces at the end of 2015-2016. And at the end of 2019-2020, there were 30,927. That is only 2,200 spaces newly created, not 5,000. Can the minister provide the most recent number of funded center-based child care spaces in Manitoba?
Minister Squires.
Good morning, Mr. Chair and all members of the committee. It's great to see everyone here this morning on this Friday morning. So I just want to correct some of the misinformation that the member has put on the record. And again, I'm not surprised that she's starting off by putting more erroneous information on the record. Let's keep in mind that this is the same member who yesterday in the House, when talking about Bill 72, which is creating a separate dignified program for the most severely disabled citizens, she referred to that as checking a box, which is incredibly insensitive to the many people who require and rely on this program and who are going to benefit from a program that we are creating. She's also someone who said that our government did no consultation on this, which nothing could be further from the truth. In fact, in our first round of consultations, we had 500 online submissions and 140 people in attendance at 5 sessions across the province, including hearing from many people in her own community. And then in our second round of consultation, we had 490 online submissions and 66 attendees through 5 virtual sessions. So certainly that is not what I would consider no consultation. And I would ask the member to check her speaking notes before putting false information on the record. So in relation to the childcare question that she had just asked, I can confirm for this committee that our government counts spaces in the exact same way that the former NDP government counted. There has been absolutely no change in the way that we count and record childcare spaces in the province of Manitoba. So she was wrong on that front. She was also wrong on the numbers. So as of March of 2020, our government had 34,700 licensed funded spaces in the province. And we added more spaces throughout the last fiscal year. And I'm just calculating those numbers right now. I'll have those numbers in terms of how many we added in the last fiscal year in short order. But I can also share then budget 2021. We have also committed to adding another 591 spaces in this upcoming fiscal year. So if you take what we've already, what we had as of March of 2020, the 34,700 spaces, of course, that is more than the number that I had quoted earlier. And in fact, our government is continuing to move forward on creating more affordable, accessible childcare spaces in the province, more than the NDP ever did. Our 5-year average is significantly higher than their 5-year average in any period in the 17 years in which they were governing. And we know that we have a long way to go in terms of creating more childcare spaces in the province of Manitoba. We recognize that that work needs to happen. We recognize that we had inherited a deficit in funded spaces in the province, and we need to continue to move forward on funding more childcare spaces. But we certainly know that the importance of this, and that is why we will continue to do that work, and we'll continue to count. We're maintaining the consistency that how childcare spaces have been funded in the province of Manitoba, whether it was under an NDP government or whether it was under PC government, it is being counted the same. And I certainly hope the member will take a moment to correct the record and apologize for that misinformation.
Ms. Adams.
Thank you, Mr. Chair. Can the minister provide me with the number of childcare coordinators currently in the province?
Minister Squires. Minister Squires, I believe you're muted. We cannot hear you.
Pardon me. I thought I'd unmuted myself, but here we go. So just to provide further information to my previous answer, I can add a report to the committee that last year we created 737 newly funded spaces in fiscal 2021 for a total of approximately 36,400 licensed funded spaces in the province. And of course, that doesn't include the 591 that Budget 21 has committed to. In regards to our childcare coordinators, we have 28 in the province. 3 of them are specifically dedicated to the Inclusion Support Program, which is a program that is incredibly beneficial for children who access childcare with special needs. This is a program that is so important that our government is enshrining that in legislation. These are also the same this is the same program that the member opposite voted against in committee. She voted against having inclusion support programs in childcare centers and having that in the legislation. So I wonder if she is now going to take issue with the fact that we have 3 childcare coordinators that are specifically dedicated to ensuring services for children with special needs through the Inclusion Support Program.
Ms. Adams.
Thank you. I voted against the clause in Bill 47 because it doesn't go far enough. By forcing children to prove they need inclusion supports with a diagnosis, this legislation excluded far too many children who may not have the time or accessibility to access such diagnosis at a young age. The minister and I discussed this at length, and she knows how strongly I feel about this issue. Can the minister please provide a breakdown with how many children the childcare coordinators, how many centers they oversee, and where they are located?
Point of order. Mr. Wiebe? Mr. Wiebe on a point of order.
Well, thank you very much, Mr. Chair. I guess it's a twofold point of order. First, I guess I would just remind all members of the committee that time is very limited in terms of our time on estimates. And while I understand there's certainly an opportunity for the minister to gather the facts, I've been in this room now for quite some time, and I think we've gotten through 2 questions since the time I've been in here. And so there's a concern about the amount of time that's being taken. The other point that I'd like to make, though, Mr. Chair, is that the minister, or the member for Thompson, has been very clear about asking questions, and obviously is expecting a factual and truthful answer. I'm concerned that when asked about the number of or how the newly created childcare spaces are being counted, the minister said there's absolutely no change in how they count spaces. We know for sure that if the minister was to look in her own reports, her own annual report, she would know that those are unfunded spaces that are now counted alongside funded spaces. Now, this could have been just a misspeak by the minister, and I give her the opportunity to correct the record now. And I understand from the clerk's perspective that this is a dispute over the facts, so I guess I'm giving the minister an opportunity to just simply correct the record, to acknowledge the fact that in her own annual report there is now an asterisk that explains that unfunded spaces are counted alongside with those funded spaces. And last year we had to go to the Ombudsman to get the department to properly report those funded spaces, so it's now incumbent on the minister to properly communicate that to the committee.
Would anyone else like to speak to the point of order? So again, just it is definitely a dispute over the facts. However, I will say that I agree that we are on a time frame. However, there is no designated time limit to come up with questions or answers, but there is in answering them, or asking the questions. So there is no point of order, and we will continue. Minister Squires.
Well, thank you very much, Mr. Chair, for that clarification and that guidance. And I can appreciate my colleague from Concordia pointing out that we are on a limited time. And I certainly do believe that it is important that we do spend this time putting information on the record. And that's why I believe that it's I concur with the member that words matter and facts matter. And that's why I've tried to impress upon my colleague when she's asking questions or when she's putting erroneous information on the record that I've had to correct her. And I'd rather not be spending time correcting my critic for childcare on other areas of programming on facts. But as long as misinformation is being put on the record, I will continue to correct that record just so that the committee is aware of all the facts that are correct. And that is something that I'm committed to, and I will continue to do that. Just to sum up the debate back and forth and the sharing of information on that inclusion support program, the member perhaps doesn't know what the inclusion support program entails. And so what she had voted against was a program that, in quotes, this program assists eligible childcare facilities by providing grants and supports, including resource materials, training, and behavioral intervention services to ensure inclusive services and to reduce or eliminate barriers so that children with a diverse range of abilities can actively participate in programming with their peers, allowing parents to work or participate in education and training. That is the definition from our bill. That is what she voted against. And so I'm unclear what she is meaning when she says that there were eligibility requirements or something else that she took offense to in that specific definition in which she voted against. And so I feel that it's very important for me to read that definition into the record so that the member can understand what it is that she specifically voted against, whether it's, ensuring inclusive services to reduce or eliminate barriers so that children with a diverse range of abilities can actively participate in programming with their peers. That is the provisions that we put in legislation that she voted against. So just to clarify for that, another point of clarification, she had said yesterday that she is voting, or one of the main concerns that she has with Bill 72, which again is dealing with providing a special income support program for people with disabilities, that she has concerns with section 5.1. I would like to just share with her before she goes ahead and votes against this clause, exactly what this clause entails. This is a section that we're amending to increase the dignity of programming for people.
Point of order, Mr. Chair.
Ms. Adams, on a point of order.
We have a limited time, and I asked the minister regarding how many childcare coordinators, where the childcare coordinators are in Manitoba, and how many facilities they oversee. If the minister would like to discuss further Bill 72, I have no problems having that discussion with her anytime. Send me the time and I will be there. But if the minister could please answer my question so we could move on and continue this estimates instead of her continuously eating up time and answering these questions. If she could actually answer the questions I'm asking, that would be very appreciated. Thank you.
Would anyone else like to speak to the point of order? So again, it is not a point of order. It is a reminder that we are having a global discussion around issues with families. And in a committee setting like this, the chair cannot rule on content or quality of the answers. So it, again, is not a point of order. Minister Squires, to conclude, please.
Thank you very much, Mr. Chair, and I appreciate your guidance, and I certainly do encourage the member to put factual information on the record in her questions, and then I don't need to spend my time correcting the record so that she's aware of the factual content and thereby wasting time, as her and the member for Concordia has alleged. So just to conclude what I was saying earlier with the section that she was taking offense to yesterday, which requires currently people with disabilities need to justify their disability every 90 days. That is every 3 months going back to a doctor to confirm that they still have a disability so that they can receive their benefits. That is the system that was maintained by the former NDP government. That is a system that we've heard loud and clear from many people with disabilities that is not only a waste of their time, it's potentially a waste of their doctor's time, and it's offensive to have someone with a severe and prolonged disability need to confirm their disability time and time again. And so 5.1 of Bill 72 will simply eliminate that requirement requirement, and that unless someone with a severe and prolonged disability has a change in circumstance, they won't need to justify their disability to anyone. And we certainly think that that is a dignified provision and something that I'm incredibly committed to. And I hope the member will reflect on that before she goes and puts more erroneous information on the record and potentially votes against something that many people with disabilities in the province is asking for. So to answer her question that she wanted to know about childcare coordinators and in the province, I mean, as the member knows, we have nearly 12, as of last fiscal year, we had nearly 1,200 licensed childcare facilities in the province.
The minister's time has expired. Ms. Adams.
Thank you. Can the minister provide a breakdown of what was spent on childcare inclusion support program in 2021?
Minister Squires.
Thank you very much, Mr. Chair. So as I was saying in my previous answer, we do have 1,172 licensed childcare facilities as of last March 2020. And of course, as I had previously stated, we have 28 childcare coordinators. So we know that each childcare coordinator oversees approximately 47 licensed facilities. These are a combination of home-based licensed facilities as well as centers that they oversee, and it is divided by region. So in regards to the inclusion support program, as I also stated into Hansard, and if the member wants to review Hansard, I was very detailed in my answer yesterday about the inclusion support program and how our policy is that any child who presents at a child care center and requires that service, they receive that service. And so every year we have a budgeted number, and then we ultimately will spend what is required depending on the service. And so some years, obviously, it goes up, and some years there may not be as much of a demand. Last year, we did go over budget because we did have more children coming into the program and receiving those that assistance through the inclusion support program. And so our expenditure for the 1920 fiscal year was $15.5 million. And of course, it is reported in the annual report every year. The 2021 tab or figure hasn't been tabulated yet. We don't have an accrual of all that was expended in the last fiscal year. And of course, that work is being undertaken right now and will be reported in our annual report that will be released when our annual reports are usually tabled in September.
Ms. Adams.
Can the minister provide how many applications were received under this program and how many of them were denied? We heard at committee there were a number of families indicating that they did not receive the inclusion support program that they had applied for.
Minister Squires.
Very much, Mr. Chair. And the member is absolutely correct that there were many families who were denied access to inclusion support programming last year. And we heard from some of those families at committee. Those are families who chose to find childcare in a for-profit center. And as the member knows, the existing legislation that we currently have prohibits the government from funding any programming, including the inclusion support programming at for-profit centers. So all those families that were unable to receive inclusion support programming for their children with special needs were denied. What we do when we're working with the for-profit centers who have a need for inclusion support programming, while we are unable to provide that because of the existing legislation framework, we do work on professional development and we work with their staff so that their staff can provide those services, and we give them professional development to meet the needs and expand the capacity based on their children that they're serving. We know that under Bill 47, with the provisions that we brought in, we will be able to fund inclusion support programming in our for-profit centers, and so that all children, regardless of where they go to childcare, we're not taking an ideological approach and separating needs based on ideology. We understand that all children with special needs in the province of Manitoba deserve to have programming to meet their needs, whether they're in a for-profit or nonprofit. And so we will be looking forward to bringing more children into the inclusion support program based on their need, not based on ideology, which is what the NDP maintains. It is what the NDP voted against. They don't want to see the inclusion support program funding offered to children outside of the nonprofit childcare center model. We think that that is the wrong approach. We think that it is important to give all children a chance in society. And so we will be bringing more children into the inclusion support program under Bill 47. I would like to point out for the member that absolutely no child under the framework that we currently have, the framework that we had inherited from the NDP government that eliminated many children from receiving these services, but any children within the framework of what we were able to provide that have requested inclusion support program, they have received it. We do not deny children inclusion support program in our nonprofit centers, and we will be looking forward to rolling that out to all centers in the province of Manitoba. It's very unfortunate that the member opposite spoke against that and has repeatedly doubled down on her assertion that children in for-profit Montessori's and for-profit other centers with special needs should be denied inclusion support programming. We think that that is shameful, and I certainly would like to offer the member an opportunity to reflect on her stance and perhaps change her position and come to realize that all children with special needs in the province of Manitoba, whether they are in a for-profit or a nonprofit center, deserve to have special inclusion programming.
Ms. Adams.
Thank you. Last year, at the beginning of the pandemic, the Manitoba government suspended funding agreements for inclusion supports for childcare facilities and asked each center to reapply for funding under a temporary model while spaces in each facility were gradually filled. This caused a lot of stress and chaos for many childcare centers during an already stressful time. I understand the minister was not in the role at the time, but would she be able to provide a briefing and an advisory note or a general insight regarding this decision?
Minister Squires.
Thank you very much, Mr. Chair. And I just want to point out for the members' benefit, as well as all members of the committee, that information about our inclusion support program at the onset of the pandemic and the arrangements that needed to be made as per public health guidelines and provisions that we had undertaken to ensure that our most vulnerable children were very safe during the pandemic. All that information is in a publicly available circular, which is on the department website. And I'm certain that the member can have her staff do that research and obtain that circular for her benefit, so she can learn more about what we did to ensure that all of our children, particularly our most vulnerable children, were kept safe at the onset of the pandemic. So in regards to what the member had asked, she is incorrect in that we were not any child that was eligible for funding and any child that was in the inclusion support program prior to the onset of the pandemic was still eligible and maintained their eligibility all throughout the pandemic. What did change, of course, was the ratio of participants to staff in a program, and that was per public health guidelines. We've all gone through that, where we've seen a reduction in cohort sizes, we've seen a reduction in ratio sizes, and that's really about maintaining some social distancing and ensuring that our children could be kept safe in a childcare setting. We also do know that there were some facilities that may have closed their doors at the onset of the pandemic for a variety of reasons. And I would like to just point out that the inclusion support program funding is maintained with the child. And so if that child's facility was closed and that child went to a different facility, that funding followed the child to that new facility. So undoubtedly, there was some flux where some children were maintaining their spaces and continuing to go to a child care center. Some children were not going to a child care center, and some children were going to different child care centers. And that is what happened and continues to happen during this pandemic. It is a very unpredictable virus, and it has created unpredictable havoc in many, many sectors, the childcare sector certainly among them, in which we have had to adapt and be flexible. And so I would also like to take this opportunity to thank everyone in my department and everyone who works in the childcare sector who was really nimble and adaptive and flexible to the diverse and changing needs of our children and of our centers and all the workers within that center to be able to accommodate and keep everyone safe. And so in order to keep our children safe, we needed to show that flexibility and that adaptability. And so I just want to reiterate for the member once again that any child that was eligible for inclusion support programming at the onset of the pandemic maintained their eligibility. They were never asked to reapply for the programming, and the funding continued to flow. They may have had different circumstances, gone to a different center, and other accommodations might have been made or adjusted or readjusted based on the pandemic. But she is absolutely incorrect when she says that children were not able to keep their funding for the inclusion support program. That is absolutely not something our government would do. It is absolutely something we did not do, and I certainly hope that the member will retract that information that she put on the record and not create more misinformation and potentially fear-mongering amongst our most vulnerable families.
Ms. Adams.
Thank you. Last year, the province sent expired masks to childcare workers. Can the minister advise if there's been any investigation into how or why this happened?
Minister Squires.
Thank you very much, Mr. Chair. And I certainly would invite the member to read Hansard from Wednesday. This is a question that she had asked on Wednesday, in which I'd shared with her and with the committee that we have upgraded all of the masks that we are providing to the childcare sector to medical level 3. And we are also increasing the quantity. So each worker in a childcare sector can be eligible for up to 4 masks or more as required per day. And we are sending 1.1 million masks a month out to the childcare sector. And so what the member is referring to was a mistake that had occurred last year. It's unfortunate that some masks had gone out to the sector. The minute that the mistake was made apparent to us, we replaced those masks, and we acted very quickly and efficiently. And we have since upgraded the grade, the quality of the mask, as well as the quantity, to ensure that all our childcare workers are kept safe.
Ms. Adams.
Thank you. And I do understand that the minister was not in her role when the expired masks were sent out. And I am happy to hear that the department is sending upgraded and high quality masks to childcare providers, because they are essential and they do need to be protected when they are at work. But it is still really troubling that that happened. And I had many childcare centers contacting me, letting me know that when they advised the Families Department, ELC, about the expired masks, they were told they were wrong. And then they were told they had to prove it. And then they had to return the masks to get the new masks that weren't expired. So I really think that there needs to be an investigation on what happened and to ensure something like that never happens again. Because I'm sure the minister can agree that expired masks should never have been sent out. And I would think she would want to do everything she could to make sure something like that would never happen again. And to do that, you have to find out how it happened.
Minister Squires.
Thank you very much, Mr. Chair, and I thank the member for the question. And as Minister of Families, I can certainly commit to this committee and more importantly to the childcare sector that I will undertake to ensure that high quality products get to them from our government. And I will be working very closely with procurement to ensure that this mistake never happens again. Undoubtedly, it created unnecessary angst and a lot of confusion in the sector. And we're deeply sorry for the trouble that it had caused the sector, and very pleased that today we've upgraded the medical grade of the mask for the childcare sector and the quantity as well. And we'll be sending out at least 1.1 million masks a month to the sector so that every childcare worker can have a mask, up to 4 masks per day at their disposal to use to keep them safe and to keep the children that they're caring for safe. And so I absolutely commit to ensuring that we make sure that this never happens again, so that we don't create unnecessary angst and problems and challenges within the sector, and really want to work with the sector to ensure that they have the proper equipment they need to do their jobs safely and effectively.
Ms. Adams?
Thank you. How many residents are currently in the Manitoba Development Center? And can the minister provide a breakdown of the plan and timeline regarding the closure of this facility?
Minister Squires?
Yes. Thank you very much, Mr. Chair. And I can confirm for the committee that currently, as of today, we have 131 residents still living at MDC. And as the committee is likely aware, we did announce at the end of January a 3-year transition plan to help each resident transition into community successfully. And so we are working on 131 individualized personal care plans that include input from the individuals themselves, their families, staff, substitute decision makers, and others to ensure that they are receiving a plan that meets their needs. We have also come up with a personalized staff stabilization program to ensure that the staffing remains at adequate levels at the MDC as long as the residents are there. Some residents we know will be able to transition into community sooner than others, and that others may take upwards up to that full 3 years. We didn't want to have families feel as though that they were needing to make rushed decisions, or substitute decision makers or residents feel rushed into the decisions that they were making. And therefore, that's why we allowed this longer period of time to transition. This is something that has been long asked for by many advocates in the community, and in fact, advocates nationwide to see the end of institutional living for individuals with disabilities. And our government agrees that community living offers an enhancement. I've heard from many individuals who have transitioned into community and heard from their families that it was challenging at first and offered rewarding experiences thereafter. And so we are allowing for a length of time to ensure that those personalized plans can be detailed and worked out and then actioned. And we've heard mostly positive comments from families. We know that there are some families that are struggling with this, and we're working very intensely with them on a one-on-one individualized basis. We know that it's very hard for some families, and our government is committed to working with them and their loved ones on having these personalized plans, and ensuring that as long as residents are living in MDC, that it is appropriately staffed, and that the care and the quality that each of those residents receives is at the same level that it was prior to the announcement that we were moving forward with community-based services and supports.
Ms. Adams?
Thank you. A recent report from the Manitoba Advocate for Children and Youth said the Manitoba services with children with disabilities are underfunded, under-resourced, and called on the province to provide more supports for children, for more supports to help children with disabilities receive appropriate care. Can the minister provide a breakdown of how the department plans to implement the recommendations of the Child's Advocate?
Minister Squires.
Thank you very much, Mr. Chair. And as the member had pointed out, on March 25th of this past year, the Manitoba Advocate for Children and Youth released a report titled "Bridging the Gaps: Achieving Substantive Equality for Children with Disabilities in the Province of Manitoba." And that report included 9 recommendations that our government is committed to implementing. And I've instructed my department to expedite the implementation of those 9 recommendations. I'd also like to just point out for the committee that all of the recommendations that are provided to us from the advocate and the reporting that government does back to the advocate on our progress is reported. So there's full accountability and transparency in terms of where we're at in implementation, and very pleased to be working with the advocate. I also want to thank her for her work that she does on behalf of children and youth in this province. And we are working very expeditiously within our own department, and then reporting this to the advocate, and she will be making those reports available to the public. And so I can assure the committee that there is full transparency and framework in terms of how we're moving forward in our progress towards the implementation. What I can also add to that is that we have already had greater collaboration between our own divisions. One of the failings that was pointed out in the advocate's report was that there wasn't collaboration between 2 departments, the Child and Family Services Division and the Children's Disability Services Division. And there's no excuse for divisions not to be collaborating and to not be working together to provide better services to Manitobans. And so that collaboration has begun and will continue to proceed so that we can ensure that we've got a strengthened program and to ensure that all of our children in the province of Manitoba, particularly the vulnerable ones that are requiring services under either of these divisions, are getting the best possible service possible. And so certainly looking forward to implementing these recommendations, certainly looking forward to creating a better system so that children are well served in the province of Manitoba and well protected and providing the supports that they need. And again, really want to thank the advocate for her work in this regard.
Ms. Adams.
Thank you. The funding for Children's Disability Services has been stagnant for the last 2 years and was frozen again in this year's budget. Meanwhile, the waitlist for this service grows steadily, growing by approximately 150 children a year. There is now almost 5,000 children on the wait list for services. Can the minister explain why the operating funding for Children's Disability Services was frozen again in this year's budget? And how are they planning to address the growing wait list for these services?
Minister Squires.
Thank you very much, Mr. Chair. And I can inform the committee that based on the recommendations of the Manitoba Advocates report, we are using that as a framework to provide better services on a go-forward basis, and we'll be increasing services and programs based on some of the findings from that report, which include expanded respite as a key element of that. And so I certainly do look forward to future announcements when we will be able to talk about an expanded respite pilot that we're currently working on. I can also share with the member that we are working on a number of initiatives to support children and support families in the province of Manitoba. In fact, that is under the first pillar of our transformation of our Child and Youth Services Division in terms of community-based intervention and community-based programming to support families and to ensure that all families have the supports that they need to keep their family together, and so that fewer children are coming into the system. One of the ways in which we're doing that is this year we had a $5.5 million increase for special needs funding in our classrooms. And this is supports for children with special needs to get additional services that they need, working with other, taking a whole of government approach really in this regard, working with other departments, the Department of Health, the Department of Education, and the newly created Department of Wellness and Recovery, to ensure that families are getting the services and supports that they need. But really want to thank the advocate for her report and that pathway or framework for providing a better way for children in the province, particularly those children who are most vulnerable.
Ms. Adams.
Thank you. And yet the budget funding for that is still frozen. How many new entries did the Community Disability Services Program accept this year? And how many did it accept in 2019 and 2020?
Minister Squires.
Thank you, Mr. Chair. I can confirm for the House that there are 6,323 children in the program or that received services in the fiscal 2021. And then that is an increase of a 16% increase in the number of children that were supported under this program since our government took office.
Ms. Adams.
Thank you. Manitobans with disabilities have raised concerns multiple times regarding the lack of triage protocol in Manitoba's ICU right now. Having a triage protocol in place would work to ensure people with disabilities and other vulnerable groups do not face discrimination if hospitals run short of ventilators, beds, or nurses. These folks have been asking for the province to develop a triage protocol for over a year. And Barrier Free Manitoba met with the former Minister of Families to discuss this issue months ago, but there has still been no movement on this. Can the minister provide details on any work the department is doing to ensure triage protocols are in place immediately? And is this a priority for the minister?
Minister Squires.
Thank you very much. And I'd like to just remind the member that this is not the Health Committee of Supply. And if she wants to pose a question about health-related questions, she's certainly welcome to enter her question into that Committee of Supply. What I also can say is that our government values all Manitobans, and we would any Manitoban with disabilities can be fully assured that they would never be discriminated against or denied care during this time or any other time in our healthcare system, and that Manitobans with disabilities will never, ever under our government get lesser treatment than anyone else. And a triage protocol that makes choices about who would be denied care is absolutely discriminatory and unacceptable, and something that our government does not support. We want to assure all Manitobans with disabilities that they will receive the same level of care as any other individual in the province of Manitoba. But again, regarding triage protocols, if the member would like to reconvene another time with families and submit her question to a health committee of supply, she's certainly welcome to do that. I do want to take a moment to talk about some of the initiatives that our government has taken to ensure that people with disabilities have received care, and in particular regarding the vaccination campaign that is underway right now. We have no fewer than 7 sites in the province that are fully accessible. And in fact, we had 2 pop-up clinics for all of our clients through the CLDS program to have a specific vaccine clinic available to them. And some of the anecdotal comments that I've heard back from our CLDS clients who have received services at some of these pop-up clinics, that they've had exceptional, fantastic care, and that they felt very well supported by the staff, and that through me, they have thanked once again some of the exceptional care providers and staff that were working in these pop-up clinics for providing that exceptional service, where they felt that all of their concerns and their anxieties that go along with attending a vaccine clinic were alleviated, and that they were very pleased at the end as to the level of care that they received. So I certainly do want to put on the record and extend my heartfelt thanks to everyone who worked at our pop-up clinics for CLDS clients, and in fact, everyone who has been a part of this vaccination campaign.
Ms. Adams.
In this year's budget, there's a significant increase to funding under Manitoba Housing and Renewal Corp's under salary and employee benefits and other expenditures. However, there is a cut to grant assistance of $27 million. Can the minister explain the $27 million cut?
Minister Squires.
Thank you very much, Mr. Chair. And I'd like to ask the committee to turn their attention to page 76 of the Manitoba Estimates of Expenditures for 21-22. And there we will find the figure that the member for Thompson has referenced. She is looking at, in the last column under 2021, under housing, the subtotal A, 128.7 million. And then under the 21-22 column, that figure is 134.1 million. What we've done is we've just broken out the expenditures. Last year, everything was totaled and to be provided a whole number. All those other factors were in that number of 128. This year, just to make it, just to be more transparent, we are showing the breakdown in the expenditures. So the 29.4 million for salary and employee benefits, the 3.1 in other expenditures, and the 101.6 in grant assistance, for a grand total of 134.1 million in the 21-22 fiscal year. So that is an increase in the budget from 128.7 to 134.1. We have just provided more information for greater transparency, and I certainly hope that if the member has any misunderstanding of how these numbers are reported, that we could have further conversations about that, and I'd be more than happy to direct her attention to the line items. But again, previous year, we included everything in the total, and this year we are breaking that out for more comprehensive, detailed information.
Ms. Adams.
How many social housing units does the province currently own, and how many social housing units have they sold since 2015, 2016? And is the minister able to provide a breakdown of this?
Minister Squires.
Thank you very much, Mr. Chair. And I'm very pleased that the member had asked about one of the programs that we think is vitally important, and that is the Rural Homeownership Program. This is where we take low-income families and we transition them from being renters into being homeowners. And we've had incredible success with some families. And we've also been able to take units that were very chronically vacant and in many cases under-maintained. And we know that when we inherited government, we had a $1.1 billion maintenance deficit that had meant that so many of our Manitoba housing units were dilapidated and underutilized or unoccupied because of the poor conditions. And so we fixed up some homes and we offered them through the Rural Home Ownership Program. Since 2019, we have had 30 successful families transition into one of these rural home ownership units. And we have seen very successful outcomes where we have taken some people who were either tenants of those places or people who were on Manitoba housing, were either occupying a different unit or were on a wait list to get into Manitoba housing, where we were able to work with those families, provide them some assistance, and get them into one of these units where they are now experiencing home ownership and all the benefits that entails. And we know that this is a very successful program. We were very pleased to hand over the keys to these 30 families and working with our partners in providing this service and ensuring that this program is successful. It is just one of the many things that we're doing to ensure that we're able to meet the housing needs of a diverse province. Another initiative that we're very proud of and that we've recently expanded our funding is with Manitoba Habitat for Humanity, working with the federal government to ensure that more housing units are built. And it is a real humbling opportunity to be witness to families getting keys to their homes for the first time. And I've heard so many positive comments from parents who are just overwhelmed with joy that they can provide that housing security and all the things that go along with having housing security to their families. And then what has been especially joyful, particularly for me, has been to actually meet some of the children who have now a new place to call home and a place that they can really settle into and live and know that they're going to be spending their childhood in that particular home and picking out a bedroom. And for many of these units, they're getting yards. And that meant, in one child's words, I can have a pet now for the first time ever because I'm not we're not in a rental situation where we know that there's a lot of freedom that comes with home ownership. And for some of those families, it means getting a pet. And so after moving into their new home, that is the one thing that they're going to be doing, is looking to adopt a fur baby into their family. And I'm very humbled to be able to be a part of providing families, particularly underprivileged families in the province of Manitoba, with those opportunities. And we're going to continue to work on this program and work with our nonprofit partners, work with Habitat for Humanity, so that we can ensure that more Manitobans get to experience the home ownership advantage.
Ms. Adams.
Thank you. So that answer is really telling to me for a couple of reasons, seeing as the minister did not provide the number of housing units the province currently owns, nor did the minister provide the number of how many units, total units, have been sold since 2015 and 2016, since they've taken government. Everybody at this committee knows that they have sold well over 36 units. So we'll also ask, on top of re-asking those questions, how many units does the province plan on building this year of socially affordable housing?
Minister Squires.
Thank you very much. And I do want to provide some information for the committee. Has sold 387 units to the private sector, but I would like to add that 374 of these units were to 185 Smith Street, which was authorized by the previous government. So we fulfilled the previous government's commitment to sell 374 units on the private sector. And then additionally, apart from the previous government's 374 units, we have authorized the sale of 13 units. So for a total of 387 units sold to the private sector. And we have 1,082 to nonprofit housing providers, which of course, working with our nonprofit housing sector, we are able to ensure that many people in Manitoba obtain housing. These are nonprofit housing providers that perhaps might be providing housing for families fleeing domestic violence. I know that that's certainly a high priority for our government to ensure that there are adequate housing options available for families who are experiencing domestic violence and need to provide rapid housing for them. This is also working with housing providers that, of course, do a lot of those wraparound supports that are so important, and achieving other outcomes for individuals who are obtaining housing in the province of Manitoba. In terms of our direct managed units, we have 11,810 units. In terms of our sponsor managed units, we have 4,715 for a total of 16,525 units. We know that housing is incredibly important in the province of Manitoba. We are committed to ensuring that we are moving forward with providing for the housing needs of all Manitobans. We've signed on to the National Bilateral Agreement, which requires and has committed Manitoba to building more units. We have also committed to refurbishing many suites. When we had formed government, we had $1.1 billion maintenance backlog in a deficit. That is because the former government didn't prioritize the maintenance, and so many units were left chronically vacant. That had direct impacts on people wanting to get into Manitoba housing because these suites were just simply not available to them. And so we have made more investments, historic investments year over year on that maintenance to ensure that we have more of our housing units available for a variety of families and a variety of accommodations. And just recently, we were able to take a number of suites. We'd started off with a Mission 50. We wanted to quickly repair and renovate 50 suites and then match 50 individuals who were experiencing homelessness or who were precariously housed at the time and get them into one of those suites. And we had tremendous success with that. In the month of March, we've committed to doing that. We've expanded that program. We're getting more and more people into these housing units each and every day, taking people who are chronically underhoused or facing housing insecurity or experiencing homelessness and getting them into their suites. But we also know just providing the keys isn't the entire answer. And we believe that the wraparound supports is absolutely integral. So I was able to provide another $2.6 million in wraparound supports. And so that the people that are experiencing homelessness who are now being given keys to a new home are also being provided with supports if they need to get support for mental health or addictions or recovery, if they want to go back to school, if they need to have some basic life skills training. All of that is being available and offered to them by our many wonderful community partners. And very pleased that we have today, we have 68 and counting people that are currently housed that were unhoused 2 months ago. And that was due to many partnerships between government and community and individuals living in Manitoba with tremendous successful outcomes. And in working with our nonprofit housing providers, they have the same requirements or the same commitment to ensuring that there are those wraparound supports or that there are those investments made, and knowing that there are circumstances where just giving someone the keys to a new place is not enough, that we need to go one step further. I think about the many families that are fleeing domestic violence and they're leaving
The
their
minister's
former
time
home.
is expired. Ms. Adams.
Thank you. Can the minister please provide what is the current wait list for Manitoba housing? What is the current vacancies for Manitoba housing? And what is the province's plan and how much housing units are they planning on building next year?
Minister Squires.
Thank you very much, Mr. Chair. And I can provide for the committee that we have since 2016 invested over $108 million in new social and affordable housing rental units. This includes a creation of 713 new units, and we will be investing another $225 million over the next 10 years by signing on to the National Housing Strategy. I would also like to share with the House that we recently signed on to that National Housing Strategy and have committed to increasing our housing unit count by 12.5% over the next 7 years. And of course, our government is committed to ensuring there is housing available for those who need it. The member had asked me about wait lists, and I just want to reiterate for the committee what the NDP approach to managing the wait list was. In fact, they kicked 12% of all their applicants who were on a Manitoba housing wait list off of their wait list for a lack of supportive documentation. This could include providing documentation such as last year's tax returns, which we know in many cases is completely unrealistic to take someone who has been precariously housed and demand to see their last year's tax returns. We know that that is not a reasonable expectation in many cases. In fact, we know that the leader of the official opposition probably can't even produce his last year's tax returns, never mind someone who is on a Manitoba wait list. And so we are lowering the barriers for people to enter into Manitoba housing wait lists. And we know that the former government, they kicked another 26% of people off of the wait list for having negative or no rental history in their applicants. And we know that that is another unreasonable approach to managing a wait list for Manitoba housing. What our government does is maintaining our commitment to finding affordable housing for all Manitobans. That is why since we formed office last year alone, for example, we provided 1,800 vulnerable people with housing last year by prioritizing those who are fleeing domestic violence and who are precariously housed or experiencing homelessness, and we're able to find housing for those 1,800 vulnerable Manitobans. And we are currently, we currently have about 1,500 vacancies in our social housing units, which half of them are under construction. We know once again that we had inherited a $1.1 billion maintenance deficit from the former government. They didn't prioritize maintaining these units, and a lot of them fell into disrepair. A lot of them were dilapidated, and we needed to refurbish them and renovate them. So we've got half of the 1,500 current vacant units under construction right now, and we'll be continuing to move all of those vacancies into tenancy arrangements as soon as they become renovated and constructed and habitable for Manitobans. And so we know that there's a lot of work to do when it comes to housing Manitobans, but we are committed to doing that. And we certainly are going to continue to make sure that Manitobans who require housing will get the housing that they need, want, and deserve. I can also share for the committee that there are 4,300 Manitobans on waitlist for housing, which is down from 9,000 people on the last year's wait list. We've cleaned up that wait list to make sure that there's no duplicates, and then we're getting people housed as quickly as possible. And again, we're not kicking people off of that wait list because they can't produce last year's tax returns.
Ms. Adams.
Thank you. And it's really telling that this minister's response to my simple question of what is the wait list is to attack the leader of the official opposition. I think that that just is telling about what kind of a government she is a part of, that instead of answering a simple question, they just go to personal attacks. And it just shows how out of touch and uninformed they really are. Now, what is the plan? This government has addressed some of my questions regarding the plan of how they're going to be addressing social housing units in Manitoba, and indicated 12% over the next 7 years. That obviously is not going to be enough. So, what is her plan to address the growing wait lists for this year and ensuring Manitobans are housed where they're needed?
Minister Squires.
Thank you, Mr. Chair. And speaking of being out of touch, I would say that allowing $1.1 billion in maintenance to accrue in a deficit is certainly indicative of a government that is out of touch. And that is certainly the legacy of the NDP, who failed to maintain the housing stocks that they had. They failed to ensure that Manitobans were getting the housing that they needed. And they were kicking 26% of the applicants off the wait list for lack of documentation, such as last year's tax returns. I would say that that is indicative of an out of touch government. Our approach is one in which we're committed to building new housing units, such as the new housing complex that is being built right now in Gimli for affordable housing for seniors, such as the common spaces that we recently announced in Brandon for youth aging out of care, such as the $5.6 million rent bank, which we know many advocates have said that this is a solution to preventing homelessness. This is going to be an option for people who are experiencing financial hardship and are afraid that they're not going to be able to make next month's payment or the month thereafter. They can go to this rent bank and obtain assistance for making their rent or their mortgage payment and ensuring that they are not they're not losing their housing arrangements because of short-term situations that they may find themselves in. And so we want to do everything that we can to prevent homelessness. And we're also making other investments, such as at 260 Toronto, along with the federal government, or the John Pollard Center that I recently announced that includes investments from both the federal and the provincial government, as well as a private individual who is committed to building more affordable housing units for Manitobans. The member had asked about the national housing strategy and why we are only committing to the 12.5%. I would just like to point out that in negotiating bilateral agreements, we have accepted the federal government's target of increasing the housing unit count by 12.5% by signing on to that national housing strategy. But that is certainly not a ceiling for us. We are going beyond that and continuing to build housing in the province of Manitoba, as a few examples that I've already outlined, and we'll continue to do more housing arrangements throughout the province of Manitoba. Recently, I had also announced $12 million for municipalities outside of the city of Winnipeg so that municipalities could have a place to draw money from for investments in creating affordable housing in their communities. This was in response to the $12 million investment in rapid housing that was made exclusively in the city of Winnipeg from the federal government. We appreciated that and acknowledged that and are very grateful for that $12 million rapid housing investment from the federal government into the city of Winnipeg. But we felt that other municipalities ought to have a similar bank, if you will, for drawing upon monies to create affordable housing for their communities. And that is why recently we announced that $12 million. And I look forward to going into these various municipalities and working with them, and whether it be in the members community of Thompson or in the Paw or Flin Flon or in Brandon and many other municipalities throughout the province of Manitoba. Very excited to be working with them on building affordable housing for all Manitobans.
Ms. Adams.
Thank you. And I will have the member for River Heights ask the remainder.
The member from River Heights.
Yeah, thank you. To the minister, there's been a concern raised in relationship to Manitoba housing, and specifically with respect to the situation at 101 Marion. This was originally 55 plus housing, but there are increasingly younger people in the building. I'm informed that there are instances where younger residents are letting non-residents into the building, and they are breaking into apartments, stealing property, making conditions unsafe for elderly residents. Indeed, that there may be gangs and drug dealers who've taken up residence in the building, as well as problems with cockroach infections. 3 suggestions have been put forward for the minister. 1, to triage homeless individuals to ensure that they are a fit for 101 Marion and to ensure that they have the supports at 101 Marion before considering housing them there, where there are so many who are seniors who are potentially at risk. Two, to have effective security on the premises. Currently, it seems that security guards are limited in what they can do to provide security. And three, have enhanced supports for seniors and a plan to assist with these problems of insect infestations.
Minister Squires?
Thank you very much. And I can appreciate that my friend from River Heights only has a few minutes, so I'll try to answer his question as quickly as possible. And I also do want to acknowledge that he's provided some solutions in his question, and I look forward to implementing his solutions and working with him on all these matters that are brought to his attention. And I appreciate whenever anybody presents potential solutions to the challenges that their constituents are facing or that they're hearing throughout the province of Manitoba. So in regards to the 101 Marion site, I can inform the member that we have increased nightly security from 10 p.m. to 5 a.m. All residents we've confirmed are 55 plus, and we've recently installed new floor by floor cameras into the building. Now, understanding that this, there still may be challenges, I'm certainly willing, and my door is always open to the member for River Heights. If he's got further issues that he's hearing about that he wants to bring to my attention, he can certainly do that at any time. I do just want to take a quick moment to say that we do recognize that there are security challenges in some of our Manitoba housing units, and that is why this year we made a $4.4 million investment. It was the largest historical investment in security in one particular year ever, and we will continue to make those investments until we are able to say that all of our residents living in Manitoba housing are living in safe housing units. And I do want to acknowledge that we did just get a particular letter from the member for River Heights and are certainly investigating any instances of unauthorized visitors attending a building, and any breaches in our policy are being investigated right now. And I'll provide all that in writing for the member for River Heights.
Mr. Gerard.
Okay. Yes, thank you. I'm going to briefly ask three quick questions for you because of the limited time. One is that there's a need for more staff in childcare and early childhood education. And while there are many who are trained in this area, there's a problem with salaries being lower than they need to be. I know the minister has commented that this is the responsibility of the board of directors, but somewhere, somehow, one clearly needs to increase the salaries or funding in order to be able to retain early childhood educators. Second, there's a considerable concern about the length of time for people on to get EIA. There's about a 2-week wait for people to get even an intake appointment. And there is a problem. Sometimes this can take much longer because people need to get identification through vital statistics. And there's quite a long, several months delay there. And also that sometimes people, when they get an intake appointment, they give a phone number, but somebody who is homeless or inadequately housed often doesn't have a phone. And so that about a third of the time when the people call for back for the intake appointment, I understand that the person doesn't answer the phone, and that the minister could perhaps look at some other way of approaching this so we don't miss so many people. Third, I know that there's been money allocated to look after the removal and replacement of lead water pipes to childcare and early childhood centers. And I wonder how many childcare and early childhood education centers have such lead water pipes and how many have had their lead water pipes removed and replaced.
Order. The time being 12:30, committee rise.